Thank you. I'd like to acknowledge the mayor who has attended this on a faithful basis, takes that time out of his day to come down here and share the moment with us. Mayor Lorenzo Langford. Thank you. And it is the truth. Bill Southry is in the house. This is like an Elvis signing here at the Mission. I had the privilege last year of talking about a very dear friend of mine, happened to be my best man at my wedding, Bob MacArthur. Bob's name's not going to be read today. Bob's was last year. And what I want you to keep in mind is that while our list changes every year, there are people that we need to keep remembering. And I remember Bob every day. I remember that he lost his way through a series of tragic events. I remember that there were only a handful of people at his funeral. A handful of people when he had had a life of impact. He had worked with me at the Harbor Fields Detention Center. He had worked in the Atlantic County Prosecutor's Office as an investigator. He had served his community in a variety of very significant capacities, helping kids throughout Atlantic City. He was admired, he was known, and those tragic events took him down. He lost his house, he lost his family, and eventually he lost his life. And I will remember Bob every day. If you want to touch a little bit of Bob, happens to be up in Bill's hallway, one of the pictures that Bob did here. He was an excellent artist. I go up and see it every time I'm here to visit Bill. So I'd like to just spend a few moments to you talking about health care and homelessness. They're intertwined. They're woven together in a very unique way. There are 45.7 million people who don't have health care, and Americans call that a tragedy. I'm not sure what word they would use to describe the fact that 70% of homeless people have no health care. That 45 million represents only 15% of the population. Contrast that with 70% of the people that are sitting in this room or sitting in the Mission or out on the street now have no health care. It's more than a tragedy. The homeless are 3 to 6 times more likely to become ill than those who are housed. Homelessness precludes good nutrition, good personal hygiene, basic first aid. Chronic conditions like TB, diabetes, HIV, extremely difficult to treat among those without housing. Listen to this now, if you experience frostbite, immersion foot, or hypothermia, the risk of death from other causes is 8 times more likely for an individual that has experienced any of those 3 things. 8 times more likely. The use of healthcare is hampered by a variety of reasons. It's access, it's not knowing, it's embarrassment about filling out forms. It's a whole variety of things. Maybe you haven't been treated well by a healthcare system in the past and you don't want to go back there again. As a result of these factors, homeless are 3 to 4 times more likely to die than the general public is in any given year. That's especially true between the ages of 18 and 54. Life expectancy, by the way, for homeless women is 4 to 31 times more likely. That depends on what study you read. 4 to 31 times more likely if you're a homeless woman. Average life expectancy among the homeless is between 42 and 52 years compared to lifestyle for someone who's housed, life expectancy of 78 years in the general population. I'd like to have everybody who works for Mission Healthcare raise your hand. There's a variety of people around here in the room. Bridget Richardson, who's our director. I think many of you know Jim Manlandra, who's our medical director, and Donna Faribault, who's our assistant medical director. We've got a whole team of people working here at the Rescue Mission. We wouldn't do it without a fabulous partner. In fact, we named it after the mission. It's called Mission Healthcare. We did that for a reason, to acknowledge the partner that we have. You're sitting in a cafeteria now that is used for all kinds of things. It's used for eating. Some of our chefs are in the back. It's used for church. It's used for services. It's used for education. Why? Because Bill and his staff allowed us to take what used to be the meeting hall and turn it into healthcare. We did that several years ago, and we've been able to provide, last year, 28,000 visits. This year, we're in over for 30,000 visits. Healthcare visits for individuals without insurance. It's 30,000 visits that 10 years ago didn't happen. That 10 years ago, if they did happen, they happened in an emergency room. and they happen to do what we call treat and street. You went to the emergency room, you got treated, you're out in the street again. No continuity of care. We're not responsible. We're there to do emergency treatment. We usually treat you at the worst time when you have something that's gone beyond where it should go, and we treat you in a way that results in you back on the street again with nobody picking up the follow-up care. Well, here at Mission Health, we can do all of that. We can treat you before anything gets chronic. We can treat you before anything gets to the emergency level. It's right here. It's down on 1601 Atlantic Avenue, and we do it at Covenant House. And we do it in a way that's respectful to you. We do it in a way that brings the highest quality of care. I can tell you the doctors and the staff, the nurses, the technicians, the front desk, we have the highest quality people that you can imagine. In fact, it's such high quality that this year the President of the United States is presenting an award to AltantiCare. And one of the reasons he's presenting that award is our ability to treat people who don't have health insurance. So we're going to be going down to Washington, D.C. in February, and we're getting something called the Malcolm Baldrige Award. And that's an award to recognize us for what we do. And especially mentioned in that, thank you. Thank you very much. Especially mentioned in that is what we do here at the Rescue Mission. And I'm extremely proud of that. So next year, you're going to hear a list this year. And what I'd like you to help us do is to cut that list in half for next year. And you can do it by going yourself when you need health care, by going out and telling your friends on the street or at the boardwalk or any other place that you hang out. If they need health care, they can get it. They can get it here. They can go right up the street at 1601 if they don't want to come to the mission. We've made it so you can go wherever you need to go here in Atlantic City to get the health care you need. And a whole variety of different services. And then when you walk out, you don't have to worry about trying to find a medication. We give you a voucher for your medication so that you can get what you need, so you can follow up with your care and take care of yourself. What we'd like to see is that list cut in half, and then we'd like to keep that up until at some point there's no list, that all of you have the opportunity to live to life expectancy of a ripe old age of 78. Let's try to work on that together, and let's try to work on that, everybody in this room helping us do that job. So thank you very much.